You guys, nobody has to buy any Girl Scout cookies. I was just.
No, are they making the Thin Mints again?
Yes, the Thin Mints are so good, but they took 2 other ones out. I read that in the paper.
They're getting rid of the s'mores.
The s'mores and something else.
Yeah.
I just told her I would take it here because I wouldn't post it on social media.
I'll order cookies too. Nobody else is asking.
I'll bring them to you.
We're live.
To the meeting?
Okay.
We're here talking about cookies.
No.
She'll have a
There's something more
distribution center
important
out in front.
I can say in my role, I partner with Girl Scouts of Northern Illinois and I do their mental health badges. So if anyone would like programming on appropriate behavioral health presentations for young children in McHenry County, I can help hook you up with that.
And I can do first responders for adults.
Great.
We don't have to do a program if we buy cookies.
You got it.
I think that's a fair trade.
Right?
That's a fair trade.
Still going. Sorry.
Hopefully, you should be sure. Oh, yeah. Seen some others right now.
Yeah, go ahead.
Good evening, and welcome to the regular meeting of the Board of Health for January 13th, 2025. I'm calling the meeting to order at 6:34. We can do a roll call, please.
Okay. Ms. Altough?
Here.
Ms. Morosky? Here. Dr. Zurich?
Here.
Ms. Carmen?
Here.
Mr. Markison?
Here.
Ms. Clark?
Here.
Dr. Katz?
Here.
Ms. Ortiz?
Here.
Ms. Gaffney?
Here.
Dr. Amsler?
Here.
Mr. Clark?
Here. Any public comment tonight?
No.
Put forward cross.
Lois?
No public comment for this evening. We will move on to item number 3 on the agenda, which is minutes approval. The minutes for item 3A. Ms. Carmen?
Yeah, I make a motion to approve the minutes from November 18th and December 22nd, 2024.
Let's do it separately, please.
Oh, sorry, okay. Just approve November 18th, regular meeting minutes.
I'll second.
Second.
Oh, I'm sorry, Barb.
Any comments or concerns on regards to the draft of the minutes?
I thought you had a
Here,
question
seeing
or
none,
concern.
a motion has been made by Ms. Carmen, second by Mr. Murkison. All those in favor, say aye.
Aye.
Those opposed, say nay. Ayes have it, motion carries.
And I motion to approve the December 2nd special meeting minutes.
A second?
I'll second.
Any questions or
Good
comments?
exercise.
You're up next. And any questions or comments? Here, seeing none. All those, the motion's been made by Ms. Carmen, second by Ms. Morowski. All those in favor, say aye. Aye. Opposed, say nay. Ayes have it, motion passed. Item number 4 is department and division updates. We'll start with Administrator Adamson.
Okay, so just to update everyone, so you'll notice Karen Dietz is no longer with us, so I will be doing, she did resign from her position, and so we're already recruiting for that
Who
position.
resigned, did she?
The fiscal operations manager. So in your packet tonight, you do have the fiscal year 24 end of year, which goes through November. Please keep in mind that is a preliminary report. It's unaudited. So those numbers are likely to change. Before she left, she did finish with county finance the audit requirements for the end of the year, but there could still be some additional items that we need to communicate with them about. And then you have the first month of December in your packet. So if anybody has any questions about the financials, I'll do my best to answer them. Otherwise, we are recruiting also for the open DON position and have identified some folks to set up interviews with.
I did have one question.
Okay.
I gotta find it.
Uh-oh.
I thought there was tuberculosis.
Okay.
There was four initials, letters that I know I should know the meaning of, but for the life of me, I can't recall what it was
Oh, in the report?
in the report.
Okay.
The LTBI.
That's the latent TB,
Latent-
correct? I'm looking at.
Okay, latent TB, okay. That answers that question, that's all I had.
That was an easy question to answer.
And you were finished?
Yep.
Yep. Director Noel, please.
Thanks. We have placed Kristen Chapman, who is one of our licensed environmental health practitioners, into our open private sewage and potable water program supervisor position. We're happy to have Kristen in that. As you know, it's been vacant for over 3 months at this point in time. So we're looking forward to that, moving forward. Also, within a couple weeks, we are going to go live with the digital platform for the septic and well permitting that we're working on in conjunction with planning and development. So right now we're in the training phases with the vendor, then we'll train our staff, and then we'll offer some Zoom type meetings for our designers and well drillers to get them up to speed, because it will be, a change in the process. It'll all be taken in online. And then finally, we are reinstituting our water drop-off program with several of the townships in the southeastern part of the county. It just allows people to drop samples off at those townships instead of having to drive all the way up here to the department. So we pick it up once a week, and I think the residents are excited to kind of have that back in place. So that's all I have. Yes, sir.
Question for you, what's the timeliness of those well samples then? Like, is there a time, like if?
Yes, so we do it typically on Tuesdays, or we do it on Tuesdays. And so they collect it the morning of, and then they drop it off. We will pick it up in the afternoon, and then the sample is run the following morning.
Okay, and if somebody drops it off Wednesday, they miss the pickup and it sits there until the next Tuesday, is that bad for the sample or something?
Yeah, it's an invalid sample. It has to be analyzed within 30 hours. So we give them a call, and if we have to, we drop it off in another sample kit and have them do it again.
Okay, so I'm assuming the townships then, if I go in there and it's a Wednesday, they're like, look, we're not gonna accept this. You have to drop it off Monday or Tuesday morning?
Yeah, you drop it off Tuesday morning, and then we pick it up that afternoon.
Okay, cool. Which townships?
We're working right now with Algonquin, McHenry, and Nunda.
That's me. All right, cool. Thank you. I'll be using that.
Okay, great.
In the past, you've had a month or a period of time where you had reduced fees or
Yes.
a water testing
Yes.
month. Are you gonna do that again?
We are. We're planning that actually for March this year. We usually do it in April, but we do have some additional supplies that will have an expiration date, so we will be doing it in March to make sure that we use all those supplies responsibly. So it'll be in March of this year.
Okay. Very good. Anybody else, questions or comments? Director Howell?
Thank you. Just a couple of things. We're getting ready to schedule all of our spring clinics. You'll remember renovation's going to be starting, so those clinics will be off-site. Hopefully we'll be able to find 2 or 3 sites to hold them in. We want to make sure there's some place where either people can drive up just like we do now with their cars and have a little bit of an indoor space. We have used Harley-Davidson in the past for that. Perhaps we'll be able to use them again. The health educator is working on setting those up for the spring. So hopefully next meeting I'll have those dates for you. We've had a little bit of turnover recently. Somebody had a baby, decided that it was better to stay home. Can't disagree with that. And then we have somebody going on to law school. So we're bringing in the right candidates. Sometimes there's other opportunities they want to have. So a little bit of turnover with that. And then our population is starting to decline a little bit. Yay, that's wonderful for us. Around the holidays, we try to transfer a little bit more as well. We had 6 puppies come in, and we transferred them right away as a foster to transfer so that they didn't have to stay in our facility without as much, nurturing as they could have had something, so. That's pretty much all I have. That, and I did notice that our volunteer hours are creeping up a little bit more, so we're happy about that.
Very good. Did you consider the fairgrounds or the Farm Bureau facilities for your clinics?
Yes, we have.
Okay.
Yes, yeah. We're kind of thinking about what month, what would the temperature be, and then, how can we move them through there, yeah.
Okay.
So that's one of the things we're considering.
Very good. Anybody else have questions or comments? Thank you. Director Barron?
Thank you. Staff will be attending stress management classes at the mental health board tomorrow. There are 2 classes. This is the final of 4 classes, so we've gotten the majority of staff through these sessions. We are working on RFPs for translations through some grants that we have, translating forms in many different languages besides Spanish. That's coming out very well. We also have the RFP for answering services. We interviewed our top 3 companies, and we're getting ready to award a bid, so that's exciting. We're also working on supervisory training program. This is going to be a program for all supervisors that have been here for a long time, new supervisors. It's going to be inclusive of budgeting, training on eGrants, which is where all our grants come from, how to maneuver that whole state of Illinois website, training line item transfers and just the basic reporting that they need to do every quarter or every month depending on the grant. So we're excited about that. It'll also be inclusive of how to use Kronos, which is our time management system, people asking for days off, vacations, sick time, and going through that. So we're working with HR on that program as well. It will also entail a lot of other dynamics that supervisors need to know, so we're incorporating that. Working with finance too on the budget aspect and what they need to know about the county budget, how to do the budgeting in June and July when we start doing that. So that's exciting. We're moving forward with the ARPA project. We are working with nursing on the move from Crystal Lake to either Building A. You'll see in your agenda packet today, we have a lease from the Mental Health Board that we're very excited about because that will work out great. Linda and I went and looked at that and it's a big thumbs up. So. Finally, just putting this out there, I was talking with Nick Kubiak, our PIO, and I want you to keep in the back of your mind that 2026 will be the 60th anniversary of the health department. And so we are trying to get some ideas together to bring forward to create a celebration for everyone. And if you have any ideas, let me know or let Nick know. And that's all I have.
Comments, questions? Go ahead.
Do you also manage the tuberculosis stuff?
That would be nursing.
That would be yours. That would be you? Okay,
It's all her.
then my question will be for you.
Just hold on to it one moment. I'm glad to hear about the supervisory training. That's good. Very good. Director Heck, please.
Thanks. Our ER program, in collaboration with our other divisions, have been trying to increase planning and education around H5N1. So we've been working on that. And in our health equity efforts, because you guys probably remember that, that's one of our health priorities in our county. We've been trying to get more programming into our disparate locations, and one of those has been identified as Marengo. So we just finished a whole body approach class there at the food pantry. We had like over 20 people participate in that. So that was an 8-week class and went really well. And then our substance use facilitator, Marissa Rybinski, has been partnering with Omni Youth Services. And so they gave us a lot of free products to distribute in the community. And two of the things are, one is locking, like a lock for pill bottles. And so it actually has like a combination lock where parents have to put a combination on there, or whoever, you can't get the pill bottle open. So we're gonna be distributing those, and then deactivation disposal kits. So that's like you put meds in this bag and you put water in it, and then you can throw it in the regular trash. So she'll be getting those out in the community. And then as Ann already mentioned, we're working on getting WIC out of Crystal Lake. So our last day of WIC in there will be February 6th, I think. And then we'll be operating out of Woodstock and our mobile clinic once we get that up and running.
Questions?
How do we divide the mobile clinic usage between either nursing, community?
Yeah, I mean, Linda can probably speak more to that, but we're just, I think we have a mobile clinic facilitator, and so she's kind of coordinating who's using the mobile clinic, when they're using it, what the requests are, and what the needs are.
Okay.
So she facilitates all of that, but I do know WIC is a priority to get into the mobile clinic, and we have not received the official approval from the state yet to be able to do that. WIC mobile clinic, there's a lot of stages that we've had to go through for this approval, but we're almost there, so we're hoping, crossing our fingers, don't hold me to this, but be able to run WIC services out of there by March.
Is this a novel use for WIC being on a mobile?
We have a couple counties in the state that have a mobile unit, but WIC never, nationally or statewide, had an approval process to do that. They kind of allowed DuPage and Boone, I think, to be able to do that on a trial basis. And now that they have seen the challenges that they have faced, they have put together a whole plan. And so now there's 4 stages that we've had to go through for the approval process. And I think we're on the final stage now, so we should be ready to go, hopefully.
Awesome. We've got a lot of love for Boone. And I know, forgive me if it's not you or if it's someone else, let me know. Is there do we keep track of how much utilization we have of this mobile unit, hours or days, or the facilitator probably has a?
Yeah, in the packet, there's even new metrics about the mobile clinic.
It's a big packet this month.
Yeah. And if those are not the metrics that, if there are additional metrics that you'd be looking for, we can certainly communicate that and put something together.
Search for mobile, will it come up? All right, I'll look. It did.
Yeah.
With Crystal Lake closing, it'll be, a needed service in the community to try and get to those areas, because we have a lot of clients that actually come from other counties, because they can come to any WIC, but they love our staff so much. We have a lot from Carpentersville, Elgin, that come out here.
Really?
So and they usually come to our Crystal Lake location, but we'll be able to pull it out there by Algonquin Lake in the Hills or Crystal Lake to be able to meet the needs of those clients too.
Thanks.
That's great. And they can access anywhere in the state, right?
Yes.
That's great. Thank you.
Very good. Assistant Director Buck.
Thank you. Good evening. So first of all, the seasonal respiratory illnesses, there was a big increase in the transmission, but the CDC put out a notice this morning actually that they're seeing signs of decline. We currently have active outbreaks. We currently have 19 active outbreaks that include the seasonal respiratory illnesses along with these GI outbreaks. There's an increase of the GI outbreaks in the community. The syndromic surveillance that we utilize shows that most likely it's a new strain of norovirus that's in the community, which the CDC is also speaking of. And they're saying that it's not a foodborne GI related, it's person to person. So, we're trying to get educators out and talking to the nursing homes, long-term care facilities, assisted living about the importance of hand hygiene, covering your mouth when you cough. But sometimes that's a little difficult with the patient population, but they're doing a lot of work behind the scenes on that. There is a slight increased outbreak in AGE specifically, which is the acute gastroenteritis. And again, that's related to person-to-person contact as opposed to food-related. The biggest reportable that we've seen, as well as the state and the CDC, have had more than 10 times the pertussis cases. So, for example, in 2023 in McHenry County, we had 13. This year, currently for 2024, at the end of the year, we had 82. So that's a pretty significant increase. So they said that, the majority of these cases were from vaccinated folks. And they're saying that the hospitalization rate has gone down, And so they're believing that anecdotally, the vaccines are really working because the majority of these people were all vaccinated, but they're still out there. So when people are still being treated, and that high-risk patient population over the age of 74 with comorbidities of, COPDs or whatnot, we're watching those very closely too, because those are the folks that are really getting hit hard and going to the hospital. That's about it for the outbreak stuff. We did implement our point of care testing center this week. We were gonna use the mobile trailer for that, but because of the temperatures, the mobile unit was working effectively, but it just kept running and running, and it just could not come to a warm enough temperature for them. So we brought staff in, we contacted our patients as they arrived. They pulled up to the first or the second slot in front of the division. The nurse went out, swabbed them like we did during COVID, ran the test for the 15 minutes that it takes to be on the spinner, and then we had their results and gave them guidance. Out of the 16 patients that we saw last week with 5 cancellations, we saw 16, 5 were positive. So we had 25% that came back positive, and we are testing for influenza A and B, COVID, and RSV. We just received our RSV kits. So we'll start using those today, and we'll go from there. So it's going well. And the mobile clinic, to answer your question, we are keeping data and statistics of that. As Megan had stated, we do have our navigator who's in charge of, we worked with Nick as well. So we have a calendar on our webpage. We have a mobile clinic webpage now that just went live. So folks can go on there and see if there's a service they want with the form that they can fill out, and then we'll get back to them to follow through with our community resource team as well being involved to get out to the community what we need. And we just started working with Harvard School District to get something out there probably in the spring this year. We want to get out in April or early May so we can get out there to do the immunizations for those families in need. Because they tried this in the past, but it hasn't really been too successful because of the fact that they make it more of like, I don't want to say a fun fair, but they make it more of a fun event where they have free haircuts and backpacks and games and, okay, if you were a child, let's go get a shot now or let's go play a game. What are you gonna take, right? So now what we're gonna try to do is do it in the afternoon hours, like 2 to 6, schedule something that's after school hours, parents can come and pick their child up. Oh, let's get your immunizations there and go on to hopefully increase the effectiveness and the overall compliance rate for vaccines, so.
And can I just make a suggestion? I love hearing those reports. You should put something in or make a report at the county board level after 6 months on the effectiveness of the mobile unit, just so that everybody has a really good handle on exactly how it's being used and how effective it is.
Sure.
But that's just, August, February, February, March, you should do something.
And just to add to that, Megan and I did go to the Woodstock Rotary and did a presentation on the mobile clinic, and we're already asked by someone there to present or to see about how they could go about getting the clinic. They have some interest, so we showed them the website, so what Linda was just talking about can go on, how to reserve it or see where it is and when it's available. So I think we're gonna get more and more interest as it's ready to go.
And I would just share that. We do good things and then we never hear how well they're being utilized. So my comment would be that would be a nice pop.
Thank you for that.
I set up a pretty kickin' block party. Think I could have it out, do some immunizations with the band?
Great. It's gonna be the new latest.
A Kona ice truck afterwards, like, can we get them like ice cream after or something? I
Yeah,
don't
you know,
know.
go, you get a shot, get a little ticket. We could work with maybe like Culver's or something like that.
Julienne's?
They're looking for always
Yeah.
Julienne's for philanthropic
Yeah.
stuff, and that would be a great idea, but they have all that other things going on. They had like the last 2 years, I guess they
It's very
did
sweet.
join and partner with the Community Resource Center in Crystal Lake, and they said they had one person have a
Well,
vaccine.
and we had like,
16
we
hours.
tried a big thing in the county
Yeah,
and
just didn't want.
there were no, it was so sad. I was like, we should do vaccinations and
Yeah.
like everyone stayed there. You were out there with your refrigerators and then no one got any shots.
But I like that idea of ice cream. We can reach out to people.
I like, you get the immunization and you get a ticket.
To go get the ice
to go
cream,
get
yeah.
it
You don't get the
first.
ice cream
You don't get
unless
it
you have the
first.
ticket.
Right,
The
they're
Kona ice
connected.
truck is so fun. Park the mobile unit, park the go to
And I would also suggest that you line up people that you know will go get a shot. so that you have a line of people who are already present,
I'll do it.
Right.
that you know will, you're the kid, you'd be perfect.
I love shots, bring them on.
You can
But I'm
never be
serious.
over-immunized.
Just so that you have already shown interest, and maybe it'll stimulate others too. And we have
I'll bring
volunteers.
my kid out, I mean, she's interested.
I would add too to that, families knowing what documentation will be needed in advance will help. I know that's been a barrier in the past. What insurance, what IDs and whatnot, especially with our Harvard population. There's different needs that we've learned through the Salvation Army, where when we did backpack distribution, that, you know, ID selections could be different and whatnot, and I think the more that it's communicated prior, then they'll know exactly, and they might not be as skeptical to go and.
And that's why we thought of that as well. So that's why we started now, and we're also partnering with the school nurse, the head of the school nurse for the Harvard School District, because she'll help us bring that on board as well. And FOSIA, our mobile clinic navigator, is involved too, so we can bring it forward that way, so. But thank you for that idea, because I might reach out for more suggestions.
The testing services that are offered, that's intended for people that feel that they have some symptoms, correct?
Correct. It's a point of care, so day of. So if you wake up in the morning, you know, unfortunately, we don't have a provider that's going to be able to give them a script. Right now, providers aren't even able to give scripts out at this time, from what we understand, for Tamiflu, for example, because the pharmacies, local pharmacies such as Walgreens, has run out. So people are coming to, like, the McHenry Pharmacy for Walgreens from, you know, Grays Lake and Island Lake, because it's out of stock. But we are giving them, if yes, you have a positive or negative, at least giving them that education. Please isolate, wear a mask, you know, stay home from work, watch your fever, and then see their follow-up with their provider. So it's been very well received.
Thank you. Dr. Amsler, you had a question?
I did, and it had to do with the tuberculosis sheet. If you look through that sheet, there are a fair number of those people who are not completing therapy for one reason or another, okay? And so my question is, if they haven't completed therapy, then they're ostensibly still infected and infectious to other people. So what are we doing as the health department to follow up on that and to reduce the risk to the others in our county?
Right. Well, we're keeping Dr. Hafiz informed of that, so he is aware of that situational awareness in those circumstances, and we do try to reach out to people. We do the 3 times with the calling. We also send a certified registered letter, but unfortunately, some of those letters come back to us. So
they've moved.
Well, they've moved, or they don't want to sign for them because it's signature of
'Cause it's,
receipt, and maybe for
registered
different
letter.
reasons. I don't know what reason that is, but you know, we're open to more suggestions on what else we can do. And Dr. Felice even said, you know, I don't know what else we can do besides that.
And I'm not certain what the legal aspect is of this. Can we force them to finish their therapy?
If it is a public health emergency like that, we have gone in the past and gotten like that court order to help us with that, so we can get them the medicine. As it is now, we pick up the medications for some of these people and we do deliver it to them, because maybe they don't have the transportation to get here, so we're more than, yes, to accommodate that way. But in those cases, and that's why it's great partnering with Dr. Hafiz, because then he looks at that, and if that's the case, then we do, unfortunately, we'll have to go that route, but fortunately, we go that route for that patient and those around them. It's a tough one sometimes.
So what happens to them then? Do they get incarcerated till they finish or no?
That part, I'm out of
Not
legal,
certain.
I don't know that answer, yeah.
I'm not either, because they
But
are,
I can look into it.
they would be a public health risk.
Correct.
So long as they don't complete therapy.
definitely a weak spot in public health where.
I'm sorry?
It's definitely a weak spot, I agree with you, it's a weak spot in public health where we have to balance the needs of many versus the rights of a few in this case, and I'm just thinking back to the Ebola outbreak they had in Dallas, was it 5 years ago now or whatever? Or it was, you know, and they had, I remember someone being ordered to stay home and they snuck out the back.
Oh, geez.
And they ended up having to stick sheriff's deputies on their house, and it's just like silly. It's just.
Did you have a further question?
I did, about the 5, you said of the 16 cases there that we tested, point of care testing, 5 were positive?
4.
4 were positive for what?
We had 2 for influenza and 2 for COVID.
Oh, okay. All right, because RSV hadn't arrived yet.
Correct,
Okay.
correct. Because the RSV cases that they did send us originally, we paid like $381.12 for 20. And when we first received them, it was the last week in October, and we were not set up with the state to have our point of care clinic yet. So we knew we were gonna be at least a month out, and the ones they sent us were due to expire pretty quickly. So I'm like, oh shoot, you know, we're not even gonna go through these. So the company that I ordered them from, I explained the circumstance, they were wonderful. They credited us back for those, and then they would send us another set when the new lot number came out with the new expiration, but that wasn't coming out until after the first of the year.
Sure.
So I wasn't able to order till January 2nd, but ER was wonderful, stepped in, and they were able to get us some from the state. So those are the ones that just arrived.
Okay.
So we'll have those.
So
But
I
then we
assume,
also have that backup through McKesson that we'll be able to order some more with.
got it. So of those positives, there's other ones that maybe would have been positive for RSV, but we
It
don't.
might have been, that is correct.
Are we, and forgive me, we're only testing children and adults over a certain
Well,
age?
we're testing adults who are age 60 and older who are high-risk patient population,
Okay.
so have other comorbidities. And then for adults 74 and older, and then 6 and
Okay, thank you.
Any further questions? Thank you.
Thank you.
Item 4 on the agenda, or item 5 on the agenda, is our consent agenda. Does any of the board members wish to have any item removed from the consent agenda and considered independently?
Then I'll make a motion to approve the consent agenda as presented.
Second.
Any questions? Okay. This is a monetary issue, we'll do a roll call vote, please.
Ms. Eltob?
Yes.
Mr. Markison?
Yes.
Ms. Morowski?
Yes.
Dr. Zurich?
Yes.
Ms. Carmen?
Yes.
Ms. Clark?
Yes.
Dr. Katz?
Yes.
Ms. Ortiz?
Yes.
Ms. Gaffney?
Yes.
Dr. Amsler?
Yes.
Mr. Clark?
Yes. That was a good one.
Yeah.
Item 6 on the agenda, contracts and agreements.
So this first one is through the nursing division. It is communicable disease testing with our specialty courts. So it's HIV, Hep B, and syphilis testing. So if Linda has anything to add, but they have a grant to do this testing, and so we will enter into this agreement with them.
Does it require any additional staff as part of the grant, or are we doing it?
Like to add staff?
Yeah.
No, we're utilizing the staff that we have.
Thank you.
How long, we anticipate this being in perpetuity? Not likely to be a one-off, right?
No, but if there's, do you know off the top of your head how long their grant is? There's a 30-day out if we need to.
Yeah, I saw that, but, okay.
We can certainly get back to you on that. It's not clear what their terms of their grant are or how long it goes.
And is it by reimbursement? Do you have to request reimbursement, or do we get the funds up front? I apologize, I didn't look.
Do you know off the top of your head?
That I don't know off the top of my head. I do remember.
It looks
that
like
we had a little bit of a discussion.
we'll get invoiced monthly
Okay.
based on the services.
So reimbursable?
Yeah.
Does the board member wish to make a motion?
I'll make the motion to approve the contract with the specialty courts for testing.
Second.
Any questions or comments? That motion has been made by Ms. Althoff, second by Ms. Gaffney, to approve the contract with Office of Special Projects, Specialty Courts. As this potentially has money impact, we'll do a roll call vote.
Dr. Amsler?
Yes.
Ms. Althoff?
Yes.
Ms. Gaffney?
Yes.
Ms. Borowski?
Yes.
Ms. Clark?
Yes.
Ms. Ortiz?
Yes.
Dr. Zurich?
Yes.
Ms. Carmen?
Yes.
Mr. Markison?
Yes.
And Mr. Clark?
Yes.
Okay, Dr. Katz?
Yes.
Majority vote in favor, motion carries. Next item is Willow Creek Church Community Resource Days.
So similarly, this is also testing, no cost to the Willow Creek Community Resource Days or its clients. But if the client has Medicaid or other insurance that we accept, then we would bill that insurance. No additional staff are being added. We're utilizing the staff that we have.
The board member wish to be recognized.
I make a motion to approve the Willow Creek Church Community Resources Days.
I second it.
Questions or comments?
We done testing like this with them in the past or other similar organizations?
Yes, so we do this at the PAD shelter already, and that was on the consent agenda, so just a similar, just a different location.
It's just different, and this
Yep.
is homeless, looks like primarily a homeless population or transiently housed?
I don't know a lot about the,
They normally are.
the CRD population.
They're
Okay.
normally a homeless population.
So this really just increases our reach. We'd want to be helping to test them anyways, whether it was here or there.
And they have, we've been there before providing other services, correct? Yeah.
At Willow Creek?
At Willow Creek?
Yes.
Yeah.
We go there monthly
Yeah.
on Fridays. We've been going for a couple of years.
And we provide them what on those Fridays?
Well, we usually have a staff member from nursing who will provide testing, or whatever they're gonna provide, immunizations for the clients there. And then we have a community resource person who links them with other services in the community as needed. And so we provide different education and all kinds of things.
And how many people are usually served on those days?
That we see each month. Well, we used to go weekly, but then we decided that we were seeing the same people all the time. So then we switched it to just going once a month. And I think they're seeing more of a variety now, but it's probably, I'm gonna say, I don't know, Luke, like 30 to 45 maybe each time.
Okay.
Yeah.
I've seen it in action, that's why I asked.
35 to 40 people being tested for
Just that we're seeing
TB and
running through
STIs?
there, yeah. And they provide all kinds of services there. Haircuts, they give them hygiene products.
They give
Not
them a
weed.
meal, they get, yeah,
Yeah.
different
STI, we
resources
probably
available.
see 4 to 5 on an average, and we go out on a month.
Okay.
Again, because there's a potential of a monetary issue, we will do a roll call vote. The motion was made by Ms. Gaffney, seconded by Ms. Clark. And we'll do a roll call, please.
Okay. Ms. Gaffney?
Yes.
Ms. Althoff?
Yes.
Ms. Borowski?
Yes.
Ms. Carmen?
Yes.
Dr. Zurich?
Yes.
Mr. Markison?
Yes.
Dr. McGuire? I'm sorry, Dr. Katz?
Yes. We look alike. Should fit in my pocket.
I said yes, didn't I say yes?
Yeah.
Dr. Amsler?
Yes.
Mr. Clark?
Yes. One more.
Oh, Ms. Ortiz, I'm sorry.
One more.
We look alike.
I didn't get it.
We're good.
You can say nay if you want.
You're in.
The motion passed. Item 6C, Medical Reserve Corp of Illinois.
So this is a new grant for $10,000 for our medical reserve corps to enhance training and increase capabilities. And I don't know, Megan, if you want to add anything?
Yeah, so we've had this strong word before. This is just another one. And her plan is to provide or get additional, use the MRC to provide additional training for Stop the Bleed. So we have trainers that can go out into the community and then get supplies to support that program.
That's a great program.
A lot of the schools have been requesting Stop the Bleed training, so we're hoping if we can get enough people trained, we can provide that training to schools too.
Board member want to be recognized?
I'll make a motion to approve.
I'll second it.
Questions, comments? The motion was made by Mr. Markison, second by Ms. Clark. As this is a money issue again, do a roll call.
Mr. Markison?
Yes.
Ms. Clark?
Yes.
Ms. Altough?
Yes.
Dr. Zurich?
Yes.
Mr. Markison?
Yes.
I'm sorry, I asked you twice.
Gets
Dr.
two
Love it, I get 2 votes.
Dr. Katz?
Yes.
Ms. Ortiz?
Yes.
Dr. Amsler?
Yes.
Ms. Morawski?
Yes.
Ms. Carmen?
Yes.
Mr. Clark?
Yes.
Yes.
I'm sorry, Ms. Gaffney.
That's all right.
The motion passed. Thank you. Item 6.
pleasure.
You've been waiting all night to hit that.
Item 6D is the NOM agreement.
So Noom, Linda, I'll probably have you jump in here, but this is for our Wise Women. Noom is a mobile app, that helps support you through fitness
Doesn't
and
everybody
weight
know what
loss.
this
I'm
is?
like,
Is this like new?
Because it's new,
It's
new, but
Yeah.
the state is required, the state has entered into an agreement
They've
that,
been part of our grant.
yes,
Yeah.
it's part of the grant, and so we're required to enter into this agreement.
I recognize that, but
But is it for weight loss or healthy eating or both? Or, you know,
Yeah.
Both, and it's kind of supplementing the Weight Watchers program that used to be affiliated because people are not participating in that anymore, and I think the state is seeing that, so now they're making it part of the grant that, you know, it has to be part of your program, so we've gotten a pretty good response, and to be honest with you, most people's reaction was very similar to everyone's here, like, is that the new?
Yeah.
You know what I mean? So, right, so everyone's thinking pretty much the same thing, and it's gotten good reception with people for healthy eating and weight loss at the same time.
it's how everybody
Just
works
doing-
today.
Right,
They
right.
work through their phone and an
Through
app.
their phone, exactly right, so,
Yeah.
yeah.
Are they gonna be providing the GLP-1 medications that they're branching out into?
I haven't heard that part because I think it's run more through like an affiliation. I don't think it's a direct physician involved in to write
Okay.
those scripts.
I know Noom's getting into that.
Oh, really?
Oh, it is?
Big money on that.
Well, there's big money in that right now because of the way of the world, but I haven't heard that they're getting in part of it. As far as I know, no. But I could be wrong.
I'm not opposed, I'm just curious where,
I don't know.
seems like, okay, but either way, it is at the direction of the state for this grant. Okay. I want the money.
Is that a motion? Is that a motion?
I'll make a motion to
There you go.
approve.
Second.
I thought you wanted to make another one.
Question or comments? And the motion was made by Mr. Markison, second by Ms. Gaffney. It does involve money again.
My pleasure.
That's our phone.
Never heard that before either.
Roll call vote, please.
Dr. Amsler?
Yes.
Ms. Ortiz?
Yes.
Ms. Clark?
Yes.
Ms. Carmen?
Yes.
Dr. Zurich?
Yes.
Ms. Morawski?
Yes.
Ms. Altough?
Yes.
Mr. Clark?
Yes.
Yes.
Yes. Motion passed. Thank you.
Now we're just having fun with you, sorry.
Now we're just playing, yeah.
No, it wasn't really.
Item 7, new and unfinished business. 7A.
So this is a resolution to reclassify one of our positions within community health from a public health nurse to a health educator. So we have a long-term employee retired. And what Megan needs now is more flexibility and someone who has more breadth of what they can do so that she can better utilize this individual. It actually results in a savings of $18,000. I don't know if you'd like to add anything in terms of.
I'll make a motion to approve the resolution authorizing the reclassification of position 0510053-99 from public health nurse 11E to health educator 7N within the Department of Health.
I second.
We're gonna
Very
say
good.
fiscal year.
Who can get a breath?
Questions, comments?
I had a question about this. So we're gonna reclassify her and still expect her to do both jobs, is that
No,
correct?
no. So we had the person who used to have this position has retired. So we're taking the opportunity to reclass the position to a health educator who.
Makes less money.
True, but also the way we have divided the division, nurses are reporting out through the nursing side. So this was the, I think, final remaining nurse on the community health side. So now that person's going to be, whoever we hire or moves into that position will have the qualifications of a health educator and be hired as a health educator.
It's not an existing employee, it's a new
It's not an
employee.
existing employee.
Allowing more flexibility.
She is an existing.
She is not,
No.
no.
Oh, she is not.
The
She'll
existing
be-
employee retired.
Yes.
Nobody's getting an
Okay.
$18,000 pay cut.
Correct,
exactly.
that is not
Yeah.
happening.
What?
Nobody's getting an $18,000 pay cut.
Oh, okay,
It's a
that's
big-
what I
The
wanted.
position,
No,
the rating
we were
of the
gonna keep
position,
her
no.
responsibilities the
No,
same
no.
and cut her salary,
No,
not
that would not
fair.
go over well.
No, that would not go over well.
Barb's like, why am I the only one asking about this? You're so good-hearted, I know, I know what
Does
you're.
that make sense now?
Okay, so the person who had the job has retired.
Yes.
We're gonna hire someone into it who will know the full scope of the job and the pay.
Their responsibilities will not be what the public health nurse was. The responsibilities will be based on a health educator job description. They will be hired for that and it's graded.
Mainly teaching people things.
Yeah, and I don't know if you want to talk about how you plan to utilize this person?
Sure, so the health educator in this position will be teaching our diabetes classes. And so although we had a nurse doing that, she kind of just that role kind of fell into her lap, but you don't need to be a nurse to be able to do that kind of
To
work.
do what?
Teach our diabetes classes.
Diabetes testing.
So she'll be doing that, wellness screenings in the community and other chronic disease prevention, but no nursing tasks.
And when we say diabetes testing, are we talking about?
No, teaching.
Teaching.
Teaching, oh. A1Cs?
Yep, cholesterol, A1C, yeah.
Okay, a motion has been made by Ms. Altough, seconded by Ms. Ortiz, to approve reclassification of a position from 11E to 7N. It's a monetary issue, so we will do a roll call vote.
Ms. Altough?
Yes.
Ms. Ortiz?
Yes.
Ms. Morawski?
Yes.
Ms. Carmen?
Yes.
Dr. Zurich?
Yes.
Mr. Markuson?
Yes.
Ms. Clark?
Yes.
Dr. Katz?
Yes.
Ms. Gaffney?
Yes.
Dr. Amsler?
Yes.
Mr. Clark?
Yes. Motion passes. 7B.
70. So mental health board leaves, I'll turn it over to Ann here in a second, but essentially as a result of the Crystal Lake renovations, we need to find some temporary space for some of our staff. We've already moved many of them and relocated folks, but there is still a need for space, specifically for our IVCCP staff.
So we went and toured the mental health board. The nice thing about it is they have the office space, they have a reception area, conference rooms. The mental health board is also on our IT platform, so we won't have to do any crazy things with computers, bring them, plug them in. There's also an additional room that we could put file cabinets in that required to be locked up with medical files. And we just thought it was the perfect place. So we do have money in the budget to fund this, and we're very excited about that. So it will run, because we were gonna try to do January 1 through December 30th, but nothing has started yet, so it'll be February 1st to November 30th. Mental Health Board runs on our budget cycle. And then we'll do a month-to-month lease, depending on how far the ARPA project is, because you never know with weather and everything else. So it's due to be completed in December of 2025, and we're hoping that we could be on schedule.
Will there be any financial impact?
The month-to-month would then be a 5% increase, but that I don't think will hurt us. And we will budget for that. We have a budget line item all set and ready to go, so we're all good with that.
To add to that as well, we don't have to move any of our furniture over there, which is always a nice perk. They're going to allow us to use their furniture that we have, so that way it's not labor intensive for a team to pack up our stuff, take it down, take it apart, unload it, rebuild it all there. So that's a significant savings as well. And as Ann said, we're using their IT. We'll bring our fax machine in and our phone numbers, but it'll be an easy transition for the staff as well. And we won't interfere with
their staff.
Right, what do they have?
NAMI.
Rosecrans is there, and then NAMI's on the other side, and then we're like on our own little side, and we really don't have patients coming in, so there really won't be any interference with that, so it should work out very well.
It's a brilliant move.
Yeah, Leo Rizzi, we met with her to begin with, and Leo's been a huge help.
She's great.
Help us move us through.
I'll make a motion.
Kyle like dared me.
It's like, you gonna make a motion tonight?
Go ahead.
No, it's fine.
Melissa, then second, okay?
I'll make a motion to approve the mental health board lease.
A second.
You gotta be fast.
Snooze, you lose.
Melissa and Barb, that's what I.
It's fine, it's fine. It's just because you challenged me.
It's good.
Although, if I were gonna support anything, it would be
I bring up
all of
the
it. I
best
support
ideas.
all of it.
Who made the motion?
This is so
I
stressful.
heard Melissa
I
and
did
followed by
it.
Barb,
Yeah, that's what I had.
before there was competition.
Okay.
It was really me.
Yeah, I'm pretty
Yeah, it
sure.
really was, but.
It was.
Any questions or comments?
You're gonna do it when I nay this, so.
The motion was made by Dr. Katz, seconded by Dr. Amsler to approve the lease agreement with the Mental Health Board for office space. As it has a rent payment, will be a roll call vote again.
Okay, Dr. Katz,
Yes.
Dr. Amsler,
Yes.
Ms. Eltoff,
Yes.
Dr. Zurich,
Yes.
Ms. Clark,
Yes.
Ms. Gaffney,
Yes.
Ms. Morawski,
Yes.
Ms. Carmen,
Yes.
Mr. Marcuson,
Yes.
Ms. Ortiz,
Yes.
Mr. Clark.
Yes, motion passed. Item 7C, conflict of interest policy and signature page.
Yes, so this is to assure that we are in compliance with our federal grants and good business practice. So Anne has been working on putting this together, and I'll just turn it over to her to do an overview.
Thank you. So for all of our grants, there are new federal requirements, and the OMBs have changed and the Federal Register. So this is under 2 CFR 200. All our grant agreements have a conflict of interest paragraph in them. This conflict of interest also trickles down to the Board of Health and to all employees. Anyone who works on touches a grant. However, when we reviewed it with the state's attorney, we felt that it would be in our best interest to have all employees sign it, because sometimes we get grants from the federal government. It does not matter whether it's a federal grant. It's a pass-through grant, which means it would go from federal to state to us. Everyone is required to do this. It's a requirement specifically in the grant that we, as a department, also have to do a conflict of interest, the Board of Health, and then all the employees. We did have an audit last year for our fiscal administrative review. They specifically asked where your signed employee conflict of interest statements. They should be in your employee files. So we would like to get that all rectified and ready and in there for our next round of audits, that we are all in compliance. So, any other questions?
How are you gonna administer that, Ann? When people are hired, they have to sign
Yes.
it, or, okay.
Yes,
And then
it will be
anytime-
done yearly, annually, as required by law. We'll do it through Power DMS as well for employees, so that they get their signature, and we'll have it on file. I think the Board of Health will just have to give it to you and have you hand sign it. Because I can't get you in Power DMS. Yes.
Do you think we could incorporate it with our yearly ethics, or the thing we sign off
The
on?
financial
Conflict of
statements?
interest?
No, you're talking about
The
Open Meetings
SCI.
Act? Is that
No,
what
the
you're
one that we
talking
get digitally
Statement of
that we have
economic
to.
No,
activity.
his economic
Oh,
interest
yeah.
statement.
Yeah, it's another, it's
SCI is a
a,
whole different thing. That's like your personal finances.
right, that is a conflict of interest thing already.
It is, but it's different than what is being required.
Yeah,
But you
I mean,
wanna
can
time
you
it
make
then.
Oh,
a,
you want to time it
Yeah,
in
can
May?
you just-
Okay.
For the
Yeah.
board.
right, and can we utilize the same portal, like another page or something, and just,
It's a different department.
Yeah, you can't do that.
No.
SCI.
I'm sure, I just want them to get on board, and,
Yeah, really, where are they?
okay,
and
all right.
clerk.
I heard no, I got it.
You'll be reaching out to the
Like
board
efficiency.
members.
Yes,
Yeah, we can
yes.
send it
One
electronically.
agency, one constitutional.
Board member wish to be recognized?
Ugh. I did the last one.
I'm putting
I
it on that
motion,
way.
I know, I motion to approve the conflict of interest policy and disclosure.
I second.
Stop, Lupe.
Any questions or comments? Any more questions or comments? Okay, a motion has been made by Dr. Katz, seconded by Ms. Ortiz. This can be done on a voice vote. All those in favor say aye.
Aye.
Opposed say nay. Ayes have it, motion carries. 7D, 2025 committee appointments.
I move that we accept the current slate for 2025.
I second.
Who seconded, I'm sorry?
Me.
Okay. Any questions or comments? Motion's been made by Ms. Gaffney, second by Ms. Altoff to approve the committee assignments for 2025. Voice vote, all those in favor say aye.
Aye.
Opposed say nay. Ayes have it, motion carried. Item 8, board issues. Any board members have an issue that they wish to discuss?
You know, I just wanted to ask, what is the status of those Narcan vending machine things? How are they working there?
They're doing well, from my understanding. I
Maybe
missed the
to-
last opioid news, but
Answer.
Yeah.
Yeah, they're doing really well, actually. MCC has actually taken over, so we were going to put, all of them were refilling a lot.
oh, good.
But the MCC one, they got a different vending machine where they can have additional products in there. So we were planning to move that one to the Woodstock new campus that they have there. But then they thought it was too big for that location, so we actually did get free from the state as part of our Strong Award some smaller boxes that can be put like on a wall. And so we got those free, so we're gonna put those in that location. So we are now going to move the big one to an unknown location at this time. But we have a list of people that are interested, so we'll just have to go through that and decide. But they're very successful and they're being refilled often, especially at the college.
Is there one at the, I'm sorry. Oh, is there one at the, because Warp Core has that new, like, store at the,
We don't have one of ours there,
oh, okay.
but they do have Narcan there that we can
Okay.
help them to refill. But it's possible that we could move our
Yeah.
if we have a space, the large one there. I actually meet with them on Wednesday, so we can bring that up.
Oh, okay.
Thank you.
Sure. Would we put a vending machine, this is just like a curiosity logistics question. Would we put a vending machine though at a place that already has like easy access for distribution from
Not
someone?
typically.
Yeah,
We would put it somewhere where
yeah.
they just don't have it, or a location where they, is not 24/7, or where we could have 24/7 access to the vending machine.
Yeah.
Like they're not open all the time,
Right.
so that would be typically where we put it.
Any vandalism or anything? Oh, great.
Do we have any way to know whether the Narcan that's dispensed from there is utilized to inhibit or deactivate an overdose?
That I don't have.
Okay.
No, it's tracked.
How would you know? Yeah, it's not skewed.
Yeah, that's why I'm asking. I mean, if anybody who doesn't know me knows I'm fully in favor of it. I know it saves lives and it's absolutely the right thing to do. But, you know, we ask about vandalism, we ask about other things. It's like, how do we know where this is going? You know, or do people use it that often? I mean, I deploy it not even that often. 911, so I'm kind of
I asked about it at
curious.
the last meeting, and the issue is, if the only time that you would get a reading on, and it's not necessarily where it came from, is if police or fire respond.
Right.
And then they have they have a report, but it doesn't, there's no connection between them saying, oh, did you use Narcan, where did you get it? It's not part of the conversation at that point.
No, I know that.
So there's no way
Just-
that there's
Well, I
no
think-
way
I
to
just-
track it.
I just mean even anecdotally,
Yeah, I
like
think-
someone comes back and they're like, hey, I love the vending machine, it saved my buddy's life.
Yeah, I mean, we have had like family, when we're out in the community doing outreach, we've had family stories of people that come back and say, this saved so-and-so or nephew or whatever. But like Juliana said, we only have the data from the first responders or the police. So we don't really have it from just the general public that may be using it and not going to an emergency facility.
Right.
But we do track the overdoses.
Yeah.
So we might see, I think we don't know, right? Before we had Narcan machines, post Narcan machine, but you can get Narcan from other places too.
Right, you wouldn't know
So,
they came from our vending
Yeah, you wouldn't know it
machines.
came from our
Right.
vending, but we might see a decline in overdose deaths, is what I'm saying, as a result of more Narcan being in the community.
That is something I would love to hear more about. And again, I'm in favor of it, get it out there, but I want to make sure our funds are used effectively. I would maybe consider even some literature on the machine or with it that says, look, if you feel comfortable reporting, please let us know. Did you use it? In what circumstance? Because in the field, when I get done with one of those, it's literally like 4 boxes. Did somebody use Narcan? Yep. Was it before you arrived or after you arrived? Yep. Who delivered it? Law enforcement, nurse, allied practitioner, layperson, that's it. So I'm just very curious about it.
Well, you maybe put a QR code on there or something.
Yeah,
People can
my
look into it.
concern with a note on there would be is that if I was somebody and I had whatever and I saw a bunch of stuff, I would walk away and just say, I'm not gonna.
I just mean, even a thing on there that says, just very human. Not like QR code would be fine, but not like legalese, not like nursing even, just, hey, you can take this, you don't have to say anything.
But you
But
wouldn't
if-
have good numbers though.
But if you'd like to tell us about how it went, we'd love to hear.
Your data wouldn't be
How would you rate
valid.
this product?
It's just if people.
No, I know that.
It's a great idea, but it would just be.
It wouldn't be worse than what it is now.
I think that maybe a different creative way of thinking about this is like, I'm gonna be thinking as I'm talking, so forgive me, but a lot of the organizations that have the vending machines in the county are funded by the mental health board. And they are all reporting statistics to the mental health board about how funding is utilized, et cetera. So each of the organizations could potentially ask questions to the people within their network that might get back to this at some point, but it would have to, do you see it like added into the
I'm gonna guess they're
quarterly
doing
data or
that
something?
unofficially right now anyway.
Probably,
And
yeah.
what we're measuring is increased knowledge and resilience.
And I'm-
So, which, knowledge and resources available. I could tell you too that like it's not documented, but our youth have definitely at least used the strips that they've come back and they're like, whoa, I told my friends about this because I had no idea. Or even the discussion of there's been like spikes of fentanyl, like here in McHenry County, yes, and right away they take strips.
Yeah.
So I know the strips have been used. No one has from the center, because the Youth and Family Center has a machine. No one has told me that they've used the Narcan, but the strips for sure. And that they fentanyl strips.
No, testing for fentanyl.
Yeah, they test it, and another thing that we can't really track, but I know it's absolutely there, is prevention, or even open discussion on the use. That, I mean, I would say, I mean, we don't track that either, but just that discussion, we've learned, having it there, we've learned that many users tell us that they're using.
Measuring it.
That's great.
Right, I'm just asking for something.
It's a good question because it's countywide. Like, how do we measure prevention? Like, oh, hey, my friend did die of an overdose because I used Narcan. Let me report that to someone so they're not reporting.
And I'm not expecting them to come to the Board of Health and say, hey, thanks, or I use this or whatever. I'm just saying, like, the store manager at Warp Core probably has very close ties with a lot of the people that utilize that facility and may use that, and they might come back and be like, hey, this is what happened. Just even some baseline anecdotal would give us a sense of.
Yeah, I mean, that's happened at Warp Core. People ran in there and got Narcan and ran like out in the street and saved people. Yeah, they told me that.
You know, to your point, we have bartenders that come in to the health department getting it for patrons that they know in their facility. We've had parents come in because they know that their children there might be a possibility, or even their parents who are 70, 80 years old, because you might need it for that. So the word is out there, and these vending machines, they're amazing. They're making a difference.
Teachers, we've had teachers come in and give it to students.
I'm gonna be my old crabby old self.
Love it.
And I think anecdotally you could do that, but my comment is who takes that information, who compiles that information, even anecdotally, who's gonna be responsible for that, and to use it for what? I mean, it's all anecdotal. It's not, if I'm doing money, it's not substantive, it's just an anecdote. I already know, just from other networks, that it is serving the purpose we wanted it to use.
When a county board member asks, what do we spend on this, or do we spend money on it, or anything like that,
Yeah, we get them.
it's worthwhile.
I mean,
Man
but
hours,
that's what I'm
or
saying.
administrative costs,
Yeah, I
or
see what
something,
you're
I'm just saying some ammunition, I wanna support this program, and I am being a good steward of it to ask, do we have any idea the effect it has? And positive, I'm on board with it, so that we can turn around and say, yeah, it does work. I think,
But I mean, if you assume even it saves one life, it works.
I'm in favor
That's
of all of them, but
There you
we
go.
could say that with everything we do, and they're gonna say there's finite resources.
What is the data collection
No, they're not.
system that the health department uses that
Now, maybe.
anyone could
10
say,
years ago.
you know, the organizations with Narcan, can you report back to us with a number or a
Change.
statistic or something?
That's
Is
very
that-
influential.
And I think the overdose itself, have they decreased? And maybe the services have been the same, but the distribution hasn't. The distribution has gone up, so that's enough to say that. It's the distribution of Narcan that is continuing to decrease our overdose, regardless of if
Well,
it's
you have to
reported.
have a huge number then, you know, I mean, it can't be
And
just like
perhaps
50
one
or
of the things we
25.
could
It has to
do
be a
is
big
if we
number
have a machine
to
that
even out
is,
all the controlled.
that we have to continually refill, is there an education area here then that we could start educating even if we did some programs then about drugs in the area? Wherever that machine is located, if it's at MCC or if it's at a college or in a school, if our machine is continually being utilized, we maybe ought to take our education team in there too to do a little bit of pre-education to these people. So we're not waiting till they need to use the Narcan to get to that point.
Yeah.
Yeah.
I think Megan does a nice job.
Yeah, we have a substance abuse
I'm sorry, what?
facilitator who does that education and gets out
Each
there.
Narcan we give out, we have educational materials with it.
Say again?
Every time we give out Narcan, we do an education piece with it, at least at the health department.
We do, but not when they go to the machine to
I
get
think
it.
there's like a little education piece in there too.
Not that people take it, but
There's a
it's
little piece of paper that tells them how to use it, right?
Do we tie them in for CPR courses as well or offer that?
We don't offer that to the general public at this time.
I think that would be a big,
Yeah, we just don't have the capacity, but we're
Yeah.
working on increasing that.
then that would be my personal big, as a CPR instructor myself and having gone to dozens of calls where someone's like, you know, even police officers, I gave the Narcan, like, they're still not breathing. Right, I mean, we miss a lot of, whether it's stimulating them or breathing for them or whatever. And I think that is one caveat to Narcan administration. Without the education, like Dr. Hams was talking about, and on the box is great. If they're not breathing and the Narcan's kicking in, it may be too slow, right? It might be, so, that's okay, anyways.
Very good. Any other board issues?
Oh, I have one.
Yes.
I was just wondering, is there any decision yet made to do with the grant, the recycling education grant, what's gonna do with the money?
Right, so, we're targeting, three areas with it, with the money that we've been allocated. So we're trying to look at increasing recycling rates at multifamily, non-residential, commercial places, and also then the western half of the county, which we have lower recycling rates. So right now, we're just waiting for the mayor's Metropolitan Caucus. They are working with the US EPA to get their process approved for oversight of the allocation of the monies. And once they do that, then we'll be able to start submitting things. So right now, we're working on the plan, and that we'll bring that back with the resolution for expenditure of the funds.
Okay, all right. And then how are they gonna track, like, do we need to track, like, we've educated and increased the recycling, or is?
No, I think overall they're looking to try to do some measurements there, but I think it's really going to be what activities we're doing, how many people we're reaching, and then what resources are we using to do that.
Oh, okay, all right. And then I saw, what was that? So I just I was in a podcast about this, or in Atlanta, and what they do on the food permits, when people are getting a food permit, they actually ask them, what is your plan with your food waste? And so just, I think it'd be nice to have on there, then just gets people thinking, okay, well, what am I just going, am I gonna throw it away? And then having, what resources we have to reduce our food waste, so.
So we have already created a survey for all of our food establishments, and so in the middle inspection of the year that we do, which is basically the training inspection then our staff will actually ask that survey of our restaurant operators, and then some of that information, then Kelly will get that at the end of that, and so we're working on those types of things.
Great, okay, okay, sure, thanks.
Any other board issues? Next item is information and communications, item 9. There's a nice report on the Medical Reserve Corp. That is a good read. And then there is a follow-up from Animal Control in regards to the 2 dogs, Brody and Bart. It was nice to see them get adopted out and now to receive some follow-up. I did find it interesting, the picture. I don't want to hurt Mike's feelings, but it's like he's presenting himself with the 2 dogs, like the dogs are happy to see him. They're not happy to see him. They're happy to see the box of milk bones on the top shelf. That's what they're looking at. But again, Mike, thank you for taking care of those dogs for us. The next is, before we enter executive session, one of the comments I wanted to make, as we come out of executive session, just so all the board members and public is aware, we will be taking board action on the employment contract in open session. So other than that, is there a motion to enter executive session?
I'll make a motion to go into executive session for the purposes of 5 ILCS 120-2 C1 and C21.
And I'll second the motion.
Okay, a motion has been made by Mr. Markison, seconded by Dr. Hansler to enter executive session. All those in favor say aye.
Aye.
Those opposed say nay. Ayes have it. We are in executive session. We'll take a few minute break.
Eat some more cookies,
Oh my gosh,
please.
already had one.
When's the actual birthday? What's the date?
Yesterday.
Was it your birthday yesterday?
Yes.
Happy birthday.
68, yay.
Oh, you're a baby.
I know.
It says 13th already.
So you're giving a presentation, I see.
I know, but it's like
Halfway. The historical.
It just
thing?
started.
Yeah, Gloria and I do that all over the place.
I was
On that topic?
Gloria and I have been doing this since 1970.
Darlene, take some cookies.
4?
Oh, no, thank you.
No one at your house wants cookies either?
Oh, we are just cooking out. Really, but thank you though.
Do you want to know?
Yeah, we're actually submitting our first.
I don't know if